for coming tonight. I know that some of you are nursing students from Carthage College, correct? Correct. Okay. So I know that some of you are here for that, just to learn. And I know that there are some community members here in the audience as well tonight. So we're just going to kind of learn from each other tonight. So the point of tonight's presentation, it's how to be a safe and supportive person for a young person or young people. And kind of dividing that out as in our community for those like 12 and up, okay? So 12 to 25, 26 years old. We're going to really talk about and hone in tonight about how to lead and start a mental health conversation. And so we just want to bring everybody up to speed. My background, just so everybody's aware, I started out as a nurse. I worked in the psychiatric field for over 30 years. I then came into love community work, working with improving access to mental health services for our kids. So still in that kind of psychiatric lens in the community, which led me to be the manager of the Racine Collaborative for Children's Mental Health, which helps to improve access for services for our kids in our community, which led us to be a group that started our first school-based mental health clinics at Racine Unified School District, and we continue to grow those services today to help support our students. And so we work on a variety of different topics. We work on stigma elimination. Part of reducing stigma, of course, is having the conversation about mental health, having people feel comfortable about having the conversation around mental health. And I think the year of COVID has escalated mental health to be a top community health issue, and more people are talking about it. And so I'm hoping that programs like this, ideas, suggestions about how we can better do that, and help everybody feel comfortable talking about mental health so that we can support each other in the right way, right? And show us each other that compassion around people experiencing this. There's been certainly different perceptions about mental health, how it's portrayed in social media, how it's being portrayed on TV and newspapers. And so we really need to work at, the facts around mental health and our language. And I think that's really important, not to call people crazy because they're not crazy. We're experiencing issues with coping. We have a lot of stress in our life, but we're not crazy. So we need to lose some of the vocabulary that we've been working with, and starting to use people living with, people experiencing, and so that we have a better context of how we're talking to people with mental health issues. So it's a really important skill set that we can all hone in on. So as we begin today, if anybody just wants to unmute, I know we have a large contingent from Carthage here tonight. Is there other groups that are being represented tonight here on, if you're not somebody else besides Carthage? You just want to unmute yourself. I just want to get a sense of if you guys are all from Carthage.
Dave Prinz, I'm from the ARC of Racine County.
Hi, Dave, welcome.
Thank you.
I'm Tony Perales I'm a supervisor for the Halo Homeless Shelter.
Hi, Tony, welcome. All righty. So what I'm going to do is start our presentation. Okay. So this program, just to kind of give you a sense of where it comes from, this program comes from WISE, Wisconsin, which is Ending Stigma Together. And it is a statewide collaborative of organizations coming to offer consultation, resources, and support for evidence-based programs for stigma elimination. So the program I'm going to show you tonight for our young people was designed by young people. So that was really awesome. So these are our youth telling us how they want us to talk to them about mental health and created this program. And so I just wanted to bring that up. Part of the program is the Safe Person campaign that was created out of WISE. This is the website that you can use, but it's really here tonight to really talk about that you're seeking to listen and support, okay? And part of the presentation today, and I want to leave us with that this, listening and being compassionate and having compassionate communication is something we want to strive towards. Is it going to be perfect every time? Are we going to mess up sometimes? Yeah, we are, okay? But that's okay because we're going to continue to work at that and reflect on how we may be able to do some things different. So this campaign really came out of that. So when we talk about the Safe Promise, I just want to spend just a few minutes on this campaign because there's 7 steps. We're going to go through the 7 steps tonight. And so there's also a decal that I can send out to everybody if you give Michelle your email if you're interested. This is just to post on your office door. This is to let people know, hey, I'm a safe person. And I'm going to listen and I'm going to support you in the way that I can. And we're going to talk a little bit about that. So in the 7 promises, just to go through them briefly, and then we'll get them much more detail, acknowledge that reaching out for support is a strength. And thinking about that, when someone comes to us and talks about an issue they're having, we should feel like honest and gratitude because they trust us, right? They're going to come to us and reach out for that help. So it's truly, truly a strength for that person. The thing we're going to get more into tonight is that listening and reacting non-judgmentally, okay? And really allowing that person to express what they're feeling without us judging what they're feeling. And then this is number 3 is kind of a tougher step sometimes for us. We have to do some internal checking, but we want to respond in a calm and reassuring manner, right? And are we saying the right things to our young people? And where are they at and what they need from us at that time? And then we want to reflect back on the feelings, strengths, and ideas I hear when listening. And then ask how I can be helpful and respond as I'm able. That's a really key point tonight too, is what can you do to be helpful, and asking that versus giving everybody solutions and ideas about, hey, I think you should do this, versus asking for that. And we'll talk more about that. And what can I do to connect to others' supports if asked? And that's a really important piece here too, is when asked. And then maintaining confidentiality and communicate if exceptions occur. So if there are, like if we looked at people who are mandatory reporters and you're going to tell me something that I need to report based on my role or based on my licensure, then you need to say that out loud, right? And we need to let people know, hey, if you say this to me, I do have to report that. That is something I have to report. So if somebody's being hurt, abused, neglect, right? Those are things that as mandatory reporters, we do have to report. All right. And so, and there's going to be more exceptions that I want to go into a little bit more detail with that for you as well. But it's something to think about. So this was a great opportunity where youth put this together. These are the things that I need. Okay. And so this is why the whole basis of this training. This is just areas in Wisconsin where they currently are doing the training. So you can kind of see how widespread across the state it really is. And this is some things that we talk about. I'm not going to spend a lot of time on this slide tonight, but really doing some mini trainings for staff. How do we get this indoctrinated into schools? We continue to work on that in ways that people feel comfortable having that mental health conversation. The first thing I want to start with, just to give it a background a little bit on just thinking about in your lives, and I just want you to think about that in your lives. Just kind of think about how many of you know someone with a mental health challenge or a diagnosis? Think about that. So how many people, can we all probably raise our hands and say, yeah, that's probably true. So I know, anxiety, trauma, depression, maybe some drug and alcohol abuse, eating disorders, schizophrenia is, that would be me, right? I know that too. I know people with that. So you think about right now about 1 in 4, right? And they even say for kids 1 in 5, okay? And so when you start to look at that we all experience a mental health issue, and they say that by the age of 24, 75% of us will have experienced in a lifetime. So think about that. So about 50% at age 14, jumps about 75% at age 24. So, think about our young people. And so that's a lot of people experiencing some mental health issues at a very young age. And so helping them through that and navigating that is really important to be a safe person for them. And that's a data, about 74% of us, or 47% of us in our lifetime will experience a diagnosable mental health issue. And so, as we start to look at this, it's really significant. And I think going back to even this year and the pandemic, that number could even be higher, right? I mean, how many of us struggled a little bit during the pandemic with our mood, maybe feeling anxious, feeling isolated, feeling alone. And those are just basics, and they grow from there, right? And they grow from there. So think about that as we move forward. The other thing, when we talking about mental health issues, just unmute yourself right now and join the conversation. What are some additional challenges that are difficult to talk about besides having a mental health issue? What are some other things that people find are difficult to talk about?
Economic issues.
Economic issues, yeah. Very good, very good. Anybody else?
Politics.
Politics. That's a great one.
Home life,
What did you say?
their home life,
Home life. What's going on in my home?
Religion,
Perfect. Religion,
Financials.
Racism. Oh,
racism.
sorry.
Racism is a great one.
I believe a lot of young people are suffering from social anxiety too.
Yes, absolutely. When we look at data coming from the school district, a lot of kids are reporting anxiety. A lot of kids are reporting anxiety. And so that's probably, and I would say, if I had to make a generic statement, anxiety is probably the biggest issue our youth are experiencing today, and rightly so, right? And you talked about that social anxiety.
Yeah.
Anyone else? Anything else? You guys had a great list. A great list. Okay. And so what I want to just focus on is a few minutes just on what are the benefits to opening up to people about our mental health challenges. And so kind of thinking about that, what are the benefits? Just, again, unmuting yourself and kind of shouting out, what are the benefits of sharing a problem, a challenge, or a difficulty with other people? What do you think those challenges, what happens when you do that?
It raises awareness.
Raises awareness. Great.
It
You
may
might open
get-
up to.
Sorry.
Oh, go ahead, Jordan.
Sorry. Okay, thanks. It may give you like some relief, and they might have some insight into that or resources that you didn't know about that could help you.
Perfect. Yes. Perfect.
You might open up to someone who might be struggling themselves,
Yes.
so you can kind of find bonding in that.
Perfect. Yes. So true.
I believe it gives them a sense of trust.
Trust is important, right? Very good. You guys are great. So when we talk about, what the benefits are, and, in some experiences that I've had, I feel relief when I tell somebody else, because now they kind of understand what's happening with me, and then they're able to support me in a way that's helpful, right? And then I, in turn, am able in time to support them in a way that's helpful to them. And so that I think that ability to feel some sense of relief, feel like I can be understood and heard, right? Those are also great things. People also, that relief of, oh, I'm keeping the secret inside, right? And so able to express that, and so you don't feel so out of place with that. And then the other thing somebody brought up too is that, I'm able to help them. Maybe I have an idea or a suggestion if they're open to that, right? And you actually feel really good about helping someone. I think all those around, how you can help advocate, right? I can help advocate for that person. So maybe they don't have the strength or know how to go down a path to address that issue, but I've had some experience, and this is something that can work for me. Or maybe of a resource that they didn't know about. Hey, did you try this? And they're like, I didn't think about that, right? And so those are all things that I really think about are things that can be meaningful and helpful. So, we think about a lot of these, and when we talk about how awkward sometimes that conversation can be around mental health. And so when we're really conveying that difficult conversation, it can be awkward. And I just want to say that. It's not always going to be smooth and it's not always going to be easy. But again, I want us to approach that with openness and know that that sometimes is scary for us. So when we look here, we can see our two youth here sitting on the couch, not looking at each other, trying, and then in the conversation is looking to be a bit awkward, isn't it? Because we're not connected, we don't know exactly what to say. And so that's what we're going to work on tonight. Like, what are those steps and what does that conversation look like? To kind of give us some more help and support with that. So again, just as a quick review of our 7 promises. So always think about our conversation with young people with the 7 promises. And so we're really going to kind of go through each of these again. I'm not going to read the screen again, but again, just kind of taking us down that path from 1 to 7 and what that looks like. Okay, so acknowledge, number 1, acknowledge that reaching out is a sense of support. So the first promise sometimes is to recognize how difficult it is for somebody to reach out for support. So if you looked at our picture that we just passed on the last slide, it was really hard, like they weren't really connecting with each other, right? It was like, oh, I want to say something, but I don't know how to say it. And so right now, think about that when a person is coming to you, people share, do so, they are incredibly brave and needing to really verify, you are incredibly brave for coming to me, but then you should be filled with gratitude that they feel comfortable coming to you. And that's the other piece of it too. So when someone starts to open up, to welcome that person by recognizing, wow, that was, I know this is really hard for you and you are really brave for bringing this up. Okay. So think about, just as a group, if you guys want to unmute yourself, what might be someone be thinking or feeling about themselves when they're reaching out for support? Here's some examples from a group at a time that you felt uneasy about seeking help and someone helped you to feel more at ease. So think about that. What might somebody be thinking or feeling about themselves when they reach out for support? What do you think they're doing? What do you think about that?
I know it's very easy to feel embarrassed when you're opening up to someone about this kind of stuff.
Yep, feeling embarrassed.
They probably feel like they're going to be judged by you or whoever they're trying to talk to.
Great, yes. And sometimes people are hesitant because of that. I think that's probably a really good reason why people are hesitant. Great.
You might be like fearful about what other people are going to think or what they're going to say.
Fearful, right. And think about, how did you make that person feel more at ease? How did that conversation go in those examples where you really could relate to somebody reached out for me for help and I made them feel more comfortable so that we could really talk about what was going on with that young person? How'd you make that person feel a little bit more at ease?
Using active listening skills, or for example, reflecting the things that they're saying,
Yes.
helps a lot because it shows that you're not just letting things go from one ear out the other.
Yeah. So what I hear you saying is this, it lets people know that you're listening. Yeah, great.
I think someone in the comments mentioned that they might feel alone. So just kind of ensuring that they're really not alone and they're not the only one going through this. And there are other people out there who could connect with them.
Great, great. Anything else? I can't see the chat now. I lost my chat feature, which I thought was going to happen, but.
I find a lot of the guys that I work with, a lot of them have their own stories.
Yes.
And And many times they can't really talk to anybody because people just look at them as being homeless. So nobody really wants to listen to what they have to say. But a lot of times they just want that one person to listen to them. You know,
Right.
sometimes they could be hurting. Sometimes they could just need help to get off drugs or alcohol. You know, they just need that person to be there for them when they come to them. Hey, I need help. Can you help me? You know,
Yes.
without somebody just turning the cheek to them.
So
And
for
I,
you in that example, it's staying there, staying present and listening,
yes,
and not just judging like, okay, I know what's going on. You don't need to talk to me anymore. And so
Yeah.
that's great, because that's really, it's really important how we greet people, welcome them into the conversation, and make them feel at ease so that they can share.
yeah. And
That's
I've
great.
had a few of them say that when they went to ask somebody for help and they told them what their problem was, right away they started getting on them and making them feel bad about themselves, you know. And that's the
And
whole opposite of what they
that's
want to hear, you know.
right. So we're going to talk about that too, because that's a great point you just brought up, because that's that judgment piece of it.
Yeah.
So, you know, really that next step, tough. I'm not saying this is an easy step, by the way, and we're not going to necessarily do this exercise, but what I really want us to think about, and I think Tony, you brought up a great example, is to listen and react non-judgmentally. Okay, and I mean, I've been doing a lot of work around like your bias, what you're thinking, what's your automatic thought process, right? Like, what do I think about certain situations, right?
Mhm.
And so I'm judging something, and we all kind of do that in a way. So we've got to be really in touch with listening to them and thinking about that. And what does it mean to react non-judgmentally? That's easier said than done, right? So think about that. You're going to listen without bias by recognizing the person's feelings are legitimate. The feelings for that person, and you're not there to negate, like, I don't think that's true, right? And so we're not there to do that. We're there to listen and support what they're telling us and what they're feeling. And we're not there to say, oh, you shouldn't feel that way. Don't feel that way. That's silly. That's stupid, right? Don't feel that way. No, we're here to listen and react non-judgmentally and really understand that, you know, they are struggling with their feelings, and that their feelings are legitimate. And even though we may be struggling a little bit to understand what's happening, it's really important that we start to look at this in a way that says, okay, am I in touch with my judgment? So kind of think about, what are some ways that you show somebody your full attention, right? So think about that. How does somebody know that you're listening to them? What are those signs that you know somebody's listening to you? What's either nonverbal, verbal? How do you walk away with a sense you're listening to me?
Direct eye contact, like they're facing you.
Okay, eye contact, they're facing you. And again, eye contact can be tricky because some cultures, eye contact wouldn't happen. So you gotta be culturally sensitive to some of that too. So if you're working with somebody that isn't from your culture, you know, how do we bring in those cultural considerations, right? And so that's a really great piece. But usually, typically, eye contact, I'm paying attention to what you're, my eye contact tells me I'm listening. I'm not on my phone, right? I'm not, oh yeah, okay, whatever. Yeah. No, but you're putting down your phone and you're giving them their full attention. That was a great one. Anyone else?
I think one of the biggest things is too is somebody comes and says, "Can I talk to you?" And at the time, if you don't have the time because you're busy, that you can make a time for them and actually be there at that time when you tell them that it'd be a good time for talking. That way,
Tony,
they
that's
get
excellent. Excellent point. The reason I say that this point is really important is if I'm an adult trying to support a young person, and you know how it is in this, I can frame up from a school setting, you know, you've got your like 20 things I have to get done today. And all of a sudden somebody approaches you and they want to talk. but you can't talk right now, right? You're not in that frame of mind to talk right now, and you can't be present. I can't fully be present right now because I got these things going out in my head. So think about times where that's happened for you, right? And somebody else has wanted to talk. And I think Tony brings up a great point in, can we meet in 15 minutes? I will have time and I really want to listen to what you have to say. Can you meet me here in 15 minutes? And I think also a place of meeting is making sure that when you're doing that, that it's a safe place, right? Are you doing this in the middle of a hallway? Are you doing this where, you know, people can listen in earshot? It's not a private conversation. So think about that. You know, for some people, they feel safer if it's a quiet place where we can talk versus a louder, like everybody can hear me in the hallway, right? Think about what it's like to be in a school setting for young people, right? So think about that. Like, can we meet over here? And I want a quiet place where you and I can just talk. And I like that piece of it. Any other things that, you know, tell you when people are listening? Putting down electronic devices, right? I think an example for me comes into, do you ever go to a physician's office and they're busy on the computer? Because everything's on the computer now, right? And they're looking at the computer and they're not really looking at you. So do you walk away with feeling listened to?
No.
Right? So I just, that's an easy example, but that's another one of those mindfulness things that you sometimes got to put down the computer to give people eye contact. Though a lot of things happen on our computers today in healthcare, right? It's an important piece of making people feel listened to. Okay. Anything else people want to bring up? Full attention, meeting expectations.
In class, we just talked about like therapeutic communication techniques, and they're kind of mentioned before, but like the active listening, the like restating,
Yes.
paraphrasing, like things like that can also like let them know that you are hearing what they're saying and you're able to kind of like repeat it back or say it in a different way to them.
Mm-hmm.
That helps
And
too.
so looking at all those positive things that you're learning on the nursing side, how does this connect? Do you see how the dots are connecting? So bringing that theory of therapeutic communication and tying that into what we're doing. Because if you look at, there's other programs out there that talk about mental health, like youth mental health first aid, right? That's a program, that's a training out there, very good training, but it covers the same concepts here, but in a little bit more detail, but it covers the same concepts. In working with young people, these are the things to keep in mind, right? What to do and making sure they're safe and ensuring their safety. And we're going to talk a little bit about how to do that as well during this program. But I think those are all real important pieces. And the piece that I think internally that we always have to be checking in with ourselves on is this, am I reacting non-judgmentally? And that's a big piece because that's something that we all have to kind of really keep in mind. And then that really ties into the next step in this process and really talk about respond in a calm manner, and it's reassuring. You know, the first thing you don't want to do is somebody tells you something and then you go, ah, no, like, because if you're coming back on that other end, right, then I'm gonna feel horrible. It's like you're making me feel worse. So making sure that how we respond and that we respond in a way that's calm and reassuring. Tough to do sometimes because I'm going to say one thing, that this is going to challenge you. All right. Because they may tell you something that is really difficult for you to hear, right? And to stay present with. And it may also trigger some past experiences off in you that you have to really be aware of and how you work with that person, because they may be triggering off some issues within you. Right? And so that's a really important piece to keep in mind. So think about a time that somebody had talked to you and perhaps you didn't respond in a calm or reassuring manner. So if anybody, if people want to share, that's great, but think about just responding out. How did that feel for you? How did that feel when somebody just didn't stay calm, right? What happened to you when somebody didn't stay calm and you told them something that they were revealing that was really hard for you? And that person didn't stay calm and they really didn't reassure you. How did you feel?
I think your patient should feel that you care, not
Yes.
just another hour of work or another dollar you're making for sitting here.
Correct. Very good. Very good. Because a lot of times too, think about past experiences. You guys come with a lot of experience with communication, right? And talking with people and, hey, I'm feeling this way. And it's that important piece of, I continue a conversation with you. I trust you because you help me, you calm me down and you provide me with reassurance, right? We don't want people to tell us what's wrong with us. We want them to reassure us. And that's a different way of communicating, right? It's a completely different way. And the outcomes can be phenomenal because once somebody trusts you one time, they're going to come back to you again because you're helpful to them. And you really want young people to feel supported and you want them to help them in the help that they want from you and be helpful to them. So think about that in terms of how am I able to stay calm? And I'm going to say this is a challenge, all right? It's not, none of these steps are like easy smeezy, I got this, I can do this. Because at times there's going to be things that, you know, we could counter back with, and I talked about this before, it's, oh, don't feel that way. That's silly. That's just stupid. That's dumb. Don't do that. Let me tell you about something that happened to me, which is a one step worse than what they're telling you, right? That's not really reassuring, right? So really identifying where people are at, meet them where they're at, and show them that compassion and understanding, which really ties into really looking at, we want to walk away from this with being realistic with our reassurance, but also making sure that there's acceptance, there's empathy and respect. So think about that. And empathy is, I can understand what you're going through right now. I understand what you're going through right now, right? And sympathy being different. Sympathy is what I feel sorry for you, right? So keep up your empathy, keep up your therapeutic communication. Those things are so important in this. The next one that really ties back into, and I've heard, you know, Tony was talking about this, reflect back feelings, strengths, and ideas I hear when listening, okay? And people have talked about this during our program already. And so the piece of being therapeutic communication with nursing students learn is a lot of that reflecting back, okay? A lot of that reflecting back, looking at what are the strengths that person is bringing to the conversation. And then ideas I hear when listening, because sometimes you hear ideas, like I hear this strength, but I also hear you wanting to do this to help yourself or to solve this problem. Bring that back as a paraphrase. Bring that back and say, what I hear you saying is. So think about that. When people have approached you and used that type of communication with you, reflecting back on your feelings, feeling that someone is validating your strengths and listening, what did you feel about that? How did that make you feel?
I think another point for people that have been at it for a long time is not to become jaded
Mm-hmm.
to other people's pain or things like that. And you really have to develop your own internal program for how do I prevent myself from being jaded. I've seen this so many times. It's routine now. You really
Mm-hmm.
need to watch yourself and have a program for not letting that happen to you.
Yeah, and I think also being jaded ties back to being judgmental. Do you think? I'm judging it already, but
Almost
that's
like
a really
putting them
good
all,
point. I
almost like putting
think,
them all in the same box.
yeah, you could. And this conversation is different though. Compassionate conversations really around digging out the feelings that they're feeling, but what are their strengths and what ideas are you hearing when they're talking? and it's bringing all the positives. It's not focused dwelling on the negative, but it's really diving in and it's bringing out the positives. Because I'll be honest, I have met a lot of patients. I have worked with a lot of psychiatric patients, and I'll tell you, everybody has a strength.
Mhm.
Everybody, I did never met one person that did not have a strength. Everybody had a strength. And that's what we started to focus on, is that strength. What's your strength today? And it may be different every day, but what is your strength today? And when I used to work in the hospital setting, that was one of our questions on the intake process we did for our inpatient admissions. What are 3 strengths that you have? And I'll tell you, everybody could fill it out. There was never one time that I ever leave that blank. So I know that we have to sometimes look for those things. I think even somebody's strength could be as you're brave to have this conversation with me as a strength, right? Opening up to me about what you're feeling and what's happening with you is a total strength. So they have some bravery about them, right? And they feel comfortable doing that. And that the fact that you're listening, reflecting back really allows that reassurance to build, right? And that we're not minimizing the feelings, we're not making people feel bad about their feelings. We're just accepting where they're at. And we're working with them and we're moving them in that direction from where they're at today. Okay. So think about that. And I'm just trying to figure, the next step, what I want us to do is really think about asking how I can be helpful and respond as I'm able. And I think there's 3 scenarios that play out. And these 3 scenarios, and because we're not in person, it's a little bit different being on the virtual meeting, but I still think that there's 3 ways we can do this, right? So the person shares their current challenge, and you're able to provide support that is requested. This is what I need from you, right? If you could help me with, right? And you're like, yeah, I can do that, right? That's scenario 1's easy, right? Because I feel good because I can do that. And so a lot of times, in people come to me and talk to me, and a lot of things that I do at the school district right now, which I really do love doing, is talking to families about how to get help, where to get help. Tell me, and I'll be like, tell me what's going on. And I'm there and I'm listening, I'm reflecting back to them. And what would you like to do? What can I do to help you today? And it might be as simple as, I don't know, I would love to see a therapist. I need to talk to somebody. Can you help me with it? Yeah, I can help you with it. Let me help you with that. And that really is a great feeling. So think about times when you've been able to help people. What does that feel like for you? Anybody?
Just a sense of gratification.
Yeah, sense of gratification. Like, wow. And sometimes too, helping people, I find that my biggest challenge for people is our mental health system is really difficult to navigate. It's not easy. Like, it's like you just don't call a place and say, all right, I think I know what's going on with me. Because sometimes people don't even know how to put it into words. They just don't feel well. And they just can't really identify all the pieces until they talk to somebody. So having somebody, to advocate for me, to help me with the process, like, who do I call to and for some people, it's like, well, I don't even know who takes my insurance. I don't even know, it's just really difficult. It's always been a real difficult system. So we try to do things to kind of ease that for people and kind of helping them through the process. The other scenario that really happens is, a person shares with us their challenge and the second person cannot respond. Like, I don't know how to, I don't know how to navigate the system either, but let's work together to see what we can find out, and let's call your insurance company and see what our first steps are. Let's do, and so kind of think about times when you've had to leverage that type of help. How has that felt?
I think it would be a bit more challenging, but if you are able to find a solution and a compromise with them, then you would still have that feeling of like satisfaction or kind of like
Yeah.
rewarding to actually
Great.
be able to help that patient, and especially or whoever wherever you're at,
Right.
or just be able to like work with them to help them
Mhm.
maybe like with their problem solving skills too.
Right. And I think that's important too, that to really talk about is working together. Don't give up. Give the sense, I'm here, I'm staying with you. We'll figure this out together. And it still gives both people that sense of, hey, I can do something about this, but yet that time to say, I don't have all the answers. I don't know if this is going to work or not, but let's learn together. And that can be a real sense of support. Now, the third one's really harder, a little bit harder. And I know this has happened. So that person shares their current challenge, but the second person doesn't understand how best to be helpful. So they ask for clarification. Like, what can I do? I don't know anything about, mental health care. I don't know anything about that. It's not been I really can't help you. But what do you think I can do to be helpful? And it may not get them to, they wanted help and they wanted to learn how to see a therapist. I don't know how to do that either. That happens. Sometimes there's just going to be somebody comes to us and the same situation happens is I just don't know how to help them. I'm not understanding exactly what they need. I'm like, yeah, I don't know. And so instead of leaving it, I don't know, let's find a piece where, I can do this, for you, right? And this piece for you. And so think about challenge like that. That's a little harder. Has anybody ever experienced something like that where you just felt like I couldn't help where I wanted to, but we were able to reach a clarifying moment or a compromise where we were able to at least do this part of it?
I've run into situations like that where I don't know
Yes,
where.
I was saying,
to get the
Halo,
help.
you must run into situations like that.
So a lot of times, so I try to keep them calm and relaxed by telling them, well, I don't know right now, but if you give me a few days, I can look and try to get a hold of somebody that maybe has that information for you. And a lot of times I see that does help because trust me, they do come back
Mm-hmm.
and they ask, hey, did you find out this for me? Did you, who do I call? Or, just to get a number. And so I found it easier to try to go around the city and try to find out different programs, for different type of situations. So that way, when people do come to me, I can look up and be like, well, these people might be able to help you,
Right.
And push
Exactly.
more that way.
And that is perfectly acceptable because a lot of times, we may not know, like, I don't know all the answers about housing. I'll tell you that. I'm a mental health gal. I can tell you the process to get into care. I can't really help. I mean, I know some things about housing. I am not an expert by any means at housing, right? I mean, I kind of know, I absolutely know about Halo. I know about transitional housing. But do I know how to apply for those programs? And do I know that the exact key person to go to? No, I don't. So I would fall into either scenario 2 or 3 on that one. But I would be like, Tony, I'm like, let me find out. Let me figure this out. Give me some time. And I like what you said too, Tony, and coming back to that, like, come back to me tomorrow and I'll get a name and a number for you. Give me some time to figure this out. So I think that's also
trust, and it builds up trust when you do that.
And that's the other thing too. And I think that's another important on all of helping is people come back to us because they trust us and we do what we say we're going to do. Right. And I think that's so important. Like, even as a lot of you guys are nurses on this program, but if you promise that patient that you're going to get them a juice, and how your mind, you get busy because now you're taking care of 5, 6 different patients. I'm like, I forgot about the juice. You never thought about the juice again. Is that patient going to trust what you say? Right. That's a simple thing, but it's an important thing. So we do what we're going to say we're going to do. Right. And that starts that trusting relationship and it builds that rapport with that patient. So, and I think the important piece here that everybody really talks to, as we respond as I'm able, and also look at those opportunities for advocacy. Like, how can I advocate for you? And doing what you just said in that example for number 3, coming back to that person with more information is really your advocating. You're really trying to help them solve this problem. And I think that that's a really great opportunity and a great sense of support for people. So think about that too. And again, an important clue here that I just continue to want to talk about, as I'm able, is really an important piece, and it's underlined here, as I'm able, okay? Because we're not always able to 100% help everybody that comes through our door, we're not, okay? It's just not possible. But as I'm able, I want to give of myself and my knowledge, or I want to find people that I can go to that are, like Tony talked about, I'm going to figure out where to go to solve this problem, and who do we call to solve this problem. Number 6, what can I do to connect others if asked? And you know, when we talk about this, I think that the important takeaway from here is, how have you felt when you're talking to somebody, letting them know how you're feeling, sharing a problem, and the response back to you is, all you need to do is this? How does that make you feel?
I think your first thought usually is easier said than done. Like, it's way easier to just say, oh yeah, just do this, than actually having to like put it into action and do it.
Mm-hmm.
I would also feel kind of like incompetent because you're saying like, oh, it's just, you just have to do this. And yeah.
Right, that's it. I mean, and I think the big takeaway too, you know, it's giving advice when you didn't want it. And here's a couple things. Sometimes I just talk because I want to get things out, but I just want you to listen. I don't need you to solve my problem, but I just need you to listen, because I just feel like I want to get it off my chest, and I would like you to listen, right? And you know, somebody said to me, I heard this a couple months ago. What do you want me to do? Do you want me to listen? Do you want me to solve a problem? You know, give me what you want me, and then that's how the conversation starts with this person. What do you want me to do? Do you want me to listen, or do you want me to solve the problem? Okay. And so they were kind of giving different options. And I think that's so great, because I'll tell you, in the course of my career in working with a lot of different patients, you know, the thing that they came to me was like, tell me what to do. And I said, you know what, I can't tell you what to do, because my solutions don't work for you. Your solutions are unique to your situation, what works for you. So, and I always tell them too, if I had all the answers to life, I would have a book and I'd be a billionaire, right? Because here's all the answers to life. You know, and so it's not that simple. It's not that simple. And I think the thing to take away here is, you know, really looking at, do they want help being connected to other supports? And did they ask for that? Or did we run in and say, hey, you need to see this person's great, and that's all you need to do is get in this support group or do this thing, or you know, go on and try out for the football team because you would be a great football player, versus here are the supports that I need if I ask for them. And that's what she's kind of talking about here, kind of discussing, you know, how it felt to get advice, and then, you know, how did that feel if we're really working with the youth in our first 5 steps. Where does advice fit in? Where does advice fit in? Right? So if you do all the techniques we talked about, we're gonna listen, and we're gonna be non-judgmental. We're gonna provide reassurance, right? And then we're going to allow them to, you know, build their feelings. You're gonna acknowledge the feelings, a strength they have. And then we might ask them what type of support would be helpful if they wanted that. Sometimes they just want us to listen, and we don't have to go anywhere else, right? We're not telling them. But if they ask us for that support, right, and they want that support, that's an important piece here. So think about what would happen. How did it feel to get advice? How'd that conversation go? What would happen if that person asked permission to give advice first? What happens? So let's kind of peel that apart in layers. So how did it feel like when you got advice without somebody just gave you advice and you didn't really ask for it? I actually wanted them to listen and I didn't want them to give me advice.
Pretty much patronizing.
Yeah. What else? Anything else? How did it feel to get advice? I didn't ask for it. I just wanted you to listen. But you didn't ask me, right? You just went right for the advice.
Another feeling could be like dismissive.
Yep.
Like they were just trying to get to that point rather than actually listening to what you have to say.
Perfect. Perfect. Yep. Minimizing how I'm feeling. That's happened to me. I felt minimized.
Kind of makes you feel upset a little bit.
Yeah. Yeah. Is it a person that you're going to continue to go to when you're needing support?
Probably not.
Probably not. Yeah. Right. Great. And so how the conversation never goes well, right? What would happen? Think about this, and this is a great technique, and it takes time to practice these to put them into action. But what would happen if you asked permission to give advice first?
I believe they'd be a little more open to what you have to say.
Yeah, and that's what Hannah Hart does here in this is a short video, is really just talks about, hey, don't always tell me what to do, right, or what I need. We can sometimes figuring that out together what you need, and allowing that person to do that, and you're just there to support the conversation. And so think about the role of this conversation with youth is not around telling them, or, kind of the worst thing. You ever think about this, but the worst thing, they might have done something and I'm like, I told you not to do that. See, I told you not to do that because now what could happen? That shuts down what? That shuts down all communication, right? Because ultimately, we're just making that person feel worse. Because now we're pointing out what went wrong and how they really should not have done that to begin with. So that's another great example of how do we go back to our steps and start to take in each of those steps. So as we look at the 7 promises, now, again, remember that each of those promises are hard, right? Because you have to remember that each one, calm and reassuring manner, being non-judgmental, right? Reflecting back on feelings. This all takes practice. The point of just learning this and doing this methodology this way is the fact that we're going to practice and we're going to be present when we can, and we're going to do the best job we can. And there's going to be times when we might slip up. Okay. And I look at my nursing students, and you're going to practice their peer communication technique with your patients. Is it going to go 100% well? No. Back in my day when I was in nursing school, we had to do this. I don't know if you guys do this still today, but we had to do what we call the process recording. And so we had to follow through a conversation, and we had to take it through all the, what areas did we use therapeutic and non-therapeutic communication skills, and take that apart, right? So this exercise is very similar to that. I want to connect dots for my nursing students. And it's really important that here's a great opportunity about being there to support the conversation and leaning in to say, if asked, is it okay to give some advice? Here's something that happened to me one time that really worked for me. I'm not sure it's going to work for you, but this is what worked for me. Right? And giving it permission and giving the context that it's your personal experience. Right? And so I just, you kind of look at when you're watching TV programs and people are talking about their problems on TV, think about and process through these 7 steps, right? And see where you see that happening. Are they being non-judgmental? Are we using our strengths? Are we asking for support, right? And are we asking for that support? And so that's an important piece, because that's where really that help can come together as you start to work together. And the last one, step that I really want to kind of spend some time on tonight is about confidentiality, right? Because there are some things that really to help maintain confidentiality and communicate if exceptions exist. And for some of us out there, right, they are mandatory reporters. So there are some things that we have to report. What happens if somebody tells you or you're asking, because sometimes you do have to ask if they're feeling safe, right? Because sometimes you're talking to somebody and you're getting a sense of asking, you know, are you safe right now? Do you feel like you're going to hurt yourself, right? That does come up. Is suicidality one of those things you can keep a secret? No. I'm going to say that. No, you can't. You've got to, when somebody tells you that they're suicidal and they're wanting to hurt themselves, I need to do something with that information. Okay, that's not something I can keep confidential. If there is abuse and neglect, that's another area where I am a mandatory reporter. If you tell me that, I have to report it. So there are times where things cannot be maintained confidentially, and that we need to let people know that these are the things that I can't keep confidential. So, and think about times, you know, when it's hard to keep a promise, to keep the content of a secret, how much discussed exception and language that feels natural to the group, right? And you really want to be looking at how do you have that conversation and flow into that naturally. Because for some people, they do understand there's a limitation, and for other people, they may not be aware of that. And communicating that ahead of time is really part of being a safe person for that person. I think, you know, Tony, you probably get that in Halo too. There's just some things that you can't keep confidential. And we have
Yeah,
to say that out loud sometimes ahead of time, so
Yeah, I
people
always
know
let
that.
them know. I always let them know when they come in my office that some
Thanks.
of our conversations, whatever you tell me, I mean, some stuff I can keep to myself, some I can't.
Yeah.
Before they even start telling me everything, you know.
Mm-hmm. Right. And I think that's the key here too, is really looking at what are those areas that we do have confidentiality around, and I can keep that. And that is between you and I. Am here to help and support you. And also looking at too, you know what, I would like to see you again tomorrow and check in with you to see how you're doing. And see what, you know, you said you were going to work on, you know, journaling your feelings tonight. Just want to check in to see how that goes for you tomorrow. Is that okay with you? Can we spend 15, 20 minutes tomorrow just talking about how you're feeling and letting people know that you are concerned about them and that you care about them. And so that's another way to kind of communicate some things and to work together on a plan, right? And letting that person lead that conversation, be in the driver's seat, so to speak. And I'm just here to help support you. So when that happens, think about that. When you do that level of being a safe person, how does that change your conversation? What changes in your mind now hearing these 7 steps? What is there anything tonight that you would have said, yeah, I got to work on that. I got to work on that. Something strike out at you in these 7 steps.
I would say that I know how to therapeutically communicate through class when we talk about it and like the different techniques. It would actually be doing it in person, and we don't really get to go to clinicals right now with COVID.
Right.
So actually being able to put it into practice would be really helpful.
Yes.
To kind of like practice like what to say and like how you say it. And because it's so easy to just like, I think about like when my friends have talked to me and I'm like, oh, well, like, why do you blah, 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 but you're not supposed to ask why questions, but you're over that over and over and over again. So I'm like, okay, I need to like, how do I say that in a different way and like ask them different questions that meet the same goal, like what I'm trying to accomplish with them.
And I think that's the important too. In all of this too, do you see people digging? I call it digging. Why do you feel that way? Tell me more about that. But do you hear that in any of this tonight? That's a really great point, because our natural tendencies are to keep digging more. Like, why do you feel that way? Tell me more about that. Well, why do you feel that way? And the why questions, and Jordan's right to bring that up, it's a non-therapeutic communication technique, right? It's not helpful to the conversation. It's making people feel like they got to justify their feelings. And so recognizing that piece of what does support look like, letting the person disclose as they feel comfortable disclosing, which is a completely different mindset of being therapeutic with people, right? And having a safe conversation is really watching not that tendency to do that. Because our humanness is like, oh, tell me more about that. Oh, trying to connect and understand. And so that's why kind of taking the 7 steps and really looking at how does that tie in for me, and what are some things that I need to be either more mindful of or more reflective of when I'm having conversations, helpful conversations with people. Has anybody felt that struggle at all to jump from, you told me this, and I just want to help you, so here, let's try this piece? Because, as a helping person, we often want to jump to the solution, right? And what the solution is for that person. Does anybody have it, like, as we look at the 7 promises, we're asking for solutions if the person's open to that, connecting them to other supports if they're open to that. Does anybody ever have had that experience where you just feel like here's the issue and here's the problem, and I just want to jump there?
Yeah, I definitely think that I'm guilty of that.
Yeah.
I work at a hospital in Illinois, and there's been many situations where I've had a lot of patients who've been like out of control, and they may not be in control themselves of what's been going on. And like, we know how to fix it. We know the easy way to fix it. But when you try and like take like the therapeutic way, it's not always the most effective way, if that makes sense. Like, to solve the problem at what's at hand versus solving the whole problem, like their future. Like, how can we stop them from using drugs? Well, why don't we try and figure out how we can stop them from feeling this way right now?
Right.
So I think that's something that I've definitely learned through experience too.
Yes. Yes. And listening to the patients know, I mean, it'd be amazing, but patients know what they need. And sometimes as nurses, we don't take the time to listen to the message, right? They seem to know what they need. And it seems like we're the ones that sometimes put our artificial barrier up to like, yeah, this works and this doesn't work. And they seem to know that. And I always give that time to bring that strength out. Like, tell me why that works for you. And they're like, this is what I need. And this is helpful to me. Last time when this happened to me, this is what I did. And it was really, really helpful. So that is really great to know. You think that's something you would like to try right now? And, and just letting them know that they're in the driver's seat for their kid. So that's really a great example. And so I think to other, students, as you guys are out there trying to try different techniques, everything will not go as easily and smooth as the textbook says it happens, right? And so it's okay to stumble, and it's okay to learn, because it takes a long time to build therapeutic relationships and to really be good at that type of skill set. And I think it always challenges us so that we can always try in like courses like this, just educational opportunities. I look at Youth Mental Health First Aid. That's also a great program on how to talk to youth, that a lot of the key concepts. So this is a little bit more higher level. That gets a little bit more into actual therapeutic communication with young people. But it's really an imperative thing to say, okay, how do I do that differently? and to get a different result. I think that was just an excellent idea on how to do that. As we think about, just one more slide here. At times, under what circumstances do you find it most difficult to be present with others and show compassion to others? What are times for you? Think about that. And you want to mute yourself. What are times where you find it really just hard to be present for somebody else and to show compassion? What's happening with you? Situations? Does anybody have any experience where you just
Maybe-
aren't the most compassionate and you're not very present?
Maybe if you don't agree with what they're saying,
Yeah.
or if like what they're doing is wrong and it's like not something that you believe in.
Okay.
Maybe when you have something going on, like mentally, mental health wise for yourself, or a family situation at home or something like that, then it's kind of hard for you to be present, whether like at work or just like with a friend.
Mhm. Very good. The other thing to
Sometimes
think.
with certain scenarios.
Yep.
Oh, sorry.
Go ahead.
Sometimes with certain scenarios, it might hit a little too close to home, and
Yep.
it can be difficult for the nurse to be present when their parent, when this patient reminds them of their parent or
Mm-hmm.
family member or whoever. It can be
Mm-hmm.
difficult.
Mm-hmm. That's going to happen. That's going to happen. What can you do about those situations? So not being able to be present, not the most compassionate right now. How can we solve that? First of all, I think that the first thing that everybody identified is there are times where I am not present and able to listen. So I may not be the best person to talk to, right? Right?
So probably be better off not saying anything and trying to see if somebody else could step in and help out.
Yes. Like right now, just explain, right now I'm just not feeling, I'm not present right now for you, and I want to apologize for that. And either make a date to re-meet because of what's happening, or I may not be the best person for this issue. Right? And there'd be times that may trigger something off in me. I'm just not the best person right now, but let me find you somebody you can talk to about it. Right?
Mhm.
Because there's going to be something that I'm not the right person to
Yeah,
talk
and
about.
then if you do try to help them going through that state with that state of mind, you might end up ruining the trust with them.
Right.
Because they're gonna feel it. They're gonna see it and feel it.
Oh, yes. 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 And are there certain people with whom you're less likely to abide by the 7 promises? And what can you do about it? So are there certain people whom you're less likely to abide by the 7 promises?
It's definitely much easier, or I mean, it's much harder to abide by them when you're treating someone or talking to someone that you may know, or like you have a
Right.
close relationship with, or that you might have had a past history with.
Mm-hmm.
So it's a lot harder when you're talking with someone like that,
Okay. Anyone else? Are there certain people whom you're less likely to abide by the 7 promises?
I believe in my case, I got like certain residents that actually say they want to get the help, but then they don't take the effort to do it. And then you
Mhm.
go out of your way to get them certain help or appointments, and then they don't go. They
Mhm.
refuse to go, and then every week it becomes more and more the same thing. Where it
Mhm.
gets to the point where now you don't really want to go all out because they're not being serious about the help that they want.
Mm-hmm. And then what can you do about that? How do you approach them?
But I still got to do my job. So basically,
Right.
I sit them down and I say, listen, I got you this appointment the other day. You didn't go. I got you this other appointment. I got you this set up over here. Why didn't you go?
Mm-hmm.
You know, I said, I'm trying to help you, but you got to help me too, you know.
Mm-hmm.
I try to keep it, you know, calm and let them know that I'm still here to help you,
Mm-hmm.
but you have to make the effort. Otherwise, I can't keep doing this, you know.
Right. And I think important too to let people know that I'm here to help you, and then kind of delving back into maybe you're giving them supports that they're not ready for, right? And
Yeah.
saying that maybe, I mean, I'm connecting you with supports, but are you ready for that?
Yeah. And I
And
mean,
not,
and I always tell them, be honest, you know, if you're not going to go, don't even take it, you know.
and just really rock. I think too, and it's harder. I think you're right there too. Is what can I do to support you today? And getting back to that support. And if these things are important to you, what can I do to help support that? And
Yeah.
putting them back in the driver's seat to, you know, look at these are the things that I want to work on.
And I've had a few of them that have done that, and then I had a few that they did it at first, and then all of a sudden they did start going and doing what they were
Yeah.
supposed to do.
Yeah. And sometimes those steps are hard to take.
Yeah.
I mean, you know, you kind of cognitively know I need that, but in your heart, you're still battling in the heart. And so sometimes those two things are working against each other.
And then it takes a lot of patience also.
And it takes a lot of patience. And I would say, and that was one thing that, you know, we kind of talked about here was the patience, you know, and what that looks like. Yeah. Perfect. So as we kind of close tonight, does anybody have any other experiences or things that they would like to talk about around the 7 promises? I just want to thank everybody for your time tonight. I hope that you found this to be meaningful for you and that you can put the 7 promises into action. If anybody's interested in a decal that I can send out to you, just send your email over to Michelle and she will get me your names, and I will certainly be more than happy to send you one. And it's a great way to let people know too, like in you know, in your space, in on your door to your office, if you have one, that you're that safe person to touch using the stuff.
Is that Michelle Gurley?
Yep, I just put it in the email.
Yep.
I mean, not email, the
Okay.
chat room rather, sorry.
And then another great resource too, if people are wanting to learn more about mental health and what's available and different resources in our community, there is a community-wide website called Racine County FamilyResources.com. And there is also all of our mental health and addiction resources are listed there. Plus there's housing and food, shelter. So there's all different resources there. Part of what's there too is a behavioral health or a mental health provider pathway, where if you're looking to see a mental health therapist in Racine, you can just fill out an online request and the therapist will return your email with an appointment to see them. And so it's a quick way if you're looking for a therapist. There's also a lot of great resources, and there is a resource library where you can learn about different diseases, about different issues with mental health, so not only physical, but also mental health issues. And then you can also create your own wellness plan. And so there's different tools that you can use to take different quizzes, and it's kind of just a variety of different information that's available. So that's something new for Racine. So it's Racine County FamilyResources.com. So take advantage of that. That's, I look at you, Tony, as when people are looking for all different things. That website has it all. And so you can spend a lot of hours just looking at all the different information that's available to us. So I just want to bring that up as a final resource. Again, if somebody is feeling like thoughts of hurting themselves, there is also a crisis services available on that website as well. And so looking at our suicide hotlines, our NAMIs, our crisis line that we do have here in Racine to help support people that are in crisis. And I want to thank everybody for your time and your engagement in this topic tonight. Thanks.
Thanks, Julie. Thank you everyone for coming. I put my email in the chat box, that if you have any questions later that you might think of, or one-to-one, I'll work with Julie to make sure that we get you information.
All right.
Thanks.
Have a great
I
day,
just sent
guys.
you out an email.
Thank you.
Okay.
Thank you.
Anna.